therapist at Melbourne Naturopathic. This is Jasmine, and we're going to rock you through the assessment sequence for carpal tunnel symptoms. The thing with carpal tunnel is that in a lot of cases it's not just in the carpal tunnel we have a problem. Often there's a nerve compression further up the chain. It could be any one of 6 places that there could be a nerve compression that causes any kind of neurological symptoms down the arm into the forearm, wrist and hand, such as numbness, tingling, weakness, pins and needles, sometimes hot and cold sensations, especially into the thumb and the first couple of fingers. That usually denotes a median nerve compression. It's one of 3 nerves going through the forearm. So here's the assessment sequence to find out where the compressions are happening and then what we can do about it. So the first place we need to look at is all the way up close to the spine to find out if there are any prior compressions of the nerves as they come out of the vertebrae. So the way we do this is with a test called the Spurling test. Essentially what I do is I just press down on the top of the head of the person, just gently, and immediately, is there anything that you can feel there, any kind of sensations down your forearm?
No.
No, nothing? Okay, that's good. I'll hold there just a little longer just to make sure. Can take up to 30 seconds. Sometimes the symptoms can then come on slowly. Anything going on?
Nope.
No? Good? Okay. So that means that there's probably no disc degeneration or spondylosis or any kind of disc or vertebral problems. But we can do a slightly more aggressive test to find out if there's anything going on either side. So if I was going to test the left side, I have Jasmine rotate 45 to the left and then side bend about 45 degrees. That compresses the vertebrae on one side. And if I add a little downward pressure, straight away is anything there?
No.
Good. I'll hold there just a little longer. Anything coming on?
No.
That's good, okay. So that tells me there's probably no problems close to the vertebrae themselves. So the next place we could possibly have a compression is in the brachial plexus of nerves, which is right up in the neck here. There are 3 muscles, the scalene muscles and sometimes the SCM muscle as well, which is this one right here. As the nerves come out from the vertebrae, they pass between these muscles, so we want to find out if these muscles are tight and compressing these muscles. So what I'm going to get you to do is just bring your hand out a little bit there, and I'm going to take your pulse, and I'm feeling, if you relax your arm there, thank you. I'm feeling it's a nice strong radial pulse. I'm feeling not so much for the speed, but for the strength of the pulse. And then if I bring the arm up like this, that just gently compresses those, it gently shortens those muscles, and if there was prior tightness of those muscles, I would probably feel a diminishing of the strength of the pulse, but I don't. It's a nice strong pulse there. So to take that test one step further, I want you to look up towards your hand and take a deep, deep breath in, deep as you can, and hold it at the top. That contracts these muscles here, and I might find you can breathe out now. That would contract those muscles intentionally, and if there is compression of the nerve there, I would feel that because the nerve takes about the same pathway as the blood vessel. So I know that if the blood pulse diminishes, that there's probably a compression of the nerve as well. In this case, there's no diminution of the pulse, so probably no compression through the brachial plexus. Next place is called the thoracic outlet. So this is simultaneously a test for thoracic outlet syndrome as well. There's a muscle in the front called the pectoralis minor. It goes between the shoulder and the ribs. The nerve passes underneath that muscle, so if we shorten that muscle off, we might feel some of the symptoms. So I want you to lay your forearm across the top of your head there, and we're just going to stay there. I'm going to give you a little bit of backwards pressure on the arm, and that shortens and pulls tight that muscle. And we're going to stay there for about 30 seconds. Now, I want you to tell me if that causes any kind of sensations like numbness, tingling, pins and needles, any kind of hot and cold, anything like that. Nothing at all? No. We'll stay there for up to 30 seconds just to make sure that I can feel that Jasmine's very bendy. There's quite a lot of flexibility in there, so we're probably not going to get anything going on there. Anything there?
No.
No, nothing at all. Not really surprising. So that takes the thoracic outlet out of the equation. If there were a compression there, then we would work in massage therapy to lengthen and release that muscle and thus release the thoracic outlet. The next place we want to check is The tendon of the biceps muscle, as it attaches to the arm there, the nerve passes underneath that tendon, so if there's a muscle strain or if there's excessive tightness in that muscle, then we would probably find a problem with that muscle. Now the biceps do two actions. One is that it bends the forearm, everyone knows that one, but it also turns the forearm over like that. So I'm going to get you to do a combination of those two movements against my resistance with about 20% of your strength. Go ahead.
Which one?
So you're going to go like this.
Oh, okay. Yep.
So go ahead. Is there anything at all that bothers you through that line? Nothing at all? Good. If she had said yes, there's pain there, then I'd know there's probably a strain in that muscle, and we would treat that strain in order to release that nerve pathway. Next one we want to check is a muscle called the Pronator Teres. It's on the forearm like that, and the job of this muscle is to turn the forearm over like that. So what I'll get you to do is I'll hold you over like that, and I'll get you to turn your arm over with about 20% of your strength. Go ahead. Is there anything that bothers you as you do that? Not at all. And there's no hesitation with that movement either, so there's probably no compression of the nerve as it goes through the Pronator Teres there. So now we're down to the last possible culprit, which is the carpal tunnel itself. Now the Tinel's test is the classic test that a lot of medical practitioners will do, which is just simply tapping the carpal tunnel. And if there were a problem in the carpal tunnel itself, you get a zinger every time I hit your forearm there, but you're not getting anything there. I can see your face is completely placid, no problem at all. The last test we're going to do, and this is also a classic carpal tunnel test as well, it's called the Phalen's test. I want you to put your hands together like this and just gently press them together like that. That compresses the carpal tunnel, shortens the space, and if there were any irritation in your carpal tunnel, immediately you would feel symptoms into your forearm. But you look like you're pretty comfortable with it. It's like a pretty comfortable, nice little stretch. Cool. So you can come on down there. So if any one of those sites has shown any kind of compression or muscle tightness or soreness, then we would know that these are the places that we need to treat to release the median nerve down the pathway and potentially to resolve completely the symptoms of numbness, tingling, paresthesia is the blanket term, those strange neurological symptoms down at the forearm, wrist and hand. So that's the sequence for carpal tunnel and similar symptoms assessment, and we'll show you the treatment sequence in a future video. Thanks for watching.